Let's talk about fever. Fever elicits a lot of anxiety. You know, your child has a fever, or someone's got a fever. In movies, it's like the fever broke and all these things. And I want to explain to you that fever is a symptom, just like a runny nose or a cough or something like this. And it's indicative of something else going on. So I think a lot of times focus is on like treating the fever, where it doesn't really need to be. As a surgeon, when I have a patient who has a fever, I'm not really as concerned about the fever itself as what is the cause of the fever. And you really need to know that if you're going to have surgery, really any single type of surgery, but when you have a general anesthetic, you will have a fever most likely for the first 48 hours. And it's normal, and you should not be alarmed by it. And I want to explain to you why you have a fever during the first 48 hours after having a general anesthetic. So I've got my little paper and pencil here. And you know, it's kind of interesting, maybe surprising, but the fever is coming from the lungs. And so this is kind of how we draw lungs in surgery here. With our two lungs here, this is the main airway. This is your trachea, and the air comes down and goes into your right lung and your left lung, and then the air is exchanged with oxygen is given up to the tissues, and the carbon dioxide is removed, and then you expel. So when you're breathing out carbon dioxide. So we're taking oxygen in, breathing out carbon dioxide. That's the general plan of how things work. But if we kind of look at a microscopic level at one of the lungs and just expand that out and look at what's happening, is we have these little things here called alveoli. And these are the little tiny micro airways. But this is where all of the real business is happening. And you've got blood that's running through here that's coming back from your heart to your lungs, and that's taking the CO2. And then that's coming through, and the CO2 is going into these little cells, these alveoli, and then that's where the gas exchange is happening. That's where the real rubber meets the road, so to speak. And so then the carbon dioxide is being taken to the lungs. That's going to eventually be excreted. And then the oxygen is coming into the blood, and that's going to go back to your heart, and that's going to be pumped out to the rest of your body. So you're getting rid of the carbon dioxide and you're getting fresh oxygen. So what does any of this have to do with fever? Well, when you have a general anesthetic and you're asleep, you can get little tiny collapse, micro collapse of these little tiny alveoli. And that little collapse it's not your whole lung is not collapsed, but these little tiny air sacs are collapsed. And by doing that, that generates a fever. That's what your body recognizes. Because if you think about it, if you have pneumonia, if you're sick in your lungs and you get little collapse, that's going to rev up your body's temperature to help fight whatever infection's going on. But with atelectasis, that's what these little microairway collapse is called after surgery, is not an infection. So you have a fever for the first 48 hours after having surgery, totally normal. Your body does not have an infection. It has these little collapses, these little airways. How do you treat it? You don't treat it with medication to try and treat the fever. You actually treat the cause, which is the collapse of these little airways. You do that by breathing. And so you're going to take deep breaths. Sometimes patients will use what's called an incentive spirometer, which is just really a little fancy device with a little tube, and you inhale, and as you inhale, it expands your lungs, opens up these little micro airways, and the fever will then go away. So either just coughing and deep breathing on your own, using an incentive spirometer device to help you breathe, getting up and walking, All of these things are what you do to treat the fever during the first 48 hours because that'll help your lungs expand, but there's no infection going on. Your body thinks it's an infection, which is why it started to create the fever, because a fever is kind of like turning up the heat. If you imagine you're cooking something, it's going to cook faster if you turn the heat up higher. And that's what your body does. If you have an infection, you're going to turn the heat up a little bit, get everything moving a little bit faster to fight the infection. But first 48 hours, fever after surgery is not an infection. It's caused by lung collapse, treated by breathing deeply, coughing, and walking.